Well, you know, people considering plastic surgery often have simple questions they might be afraid to ask. So joining us this morning is Dr. John Mendelsohn, Medical Director of the Advanced Cosmetic Surgery and Laser Center, to explain what plastic surgery is all about. Thanks for joining us.
Thank you for inviting me.
First, I want to say, too, you went to China last year to help children with facial deformities.
I did, that's correct. I was involved with a program called Face-to-Face International, who traveled to Linyi, China, and operated on about 30 children with facial deformities.
Wonderful program. Now, I know probably most of what you do, though, is not that kind of work. It's for people coming in wanting elective plastic surgery, correct?
That's correct. In Cincinnati, that's what we do mostly.
So let's talk about some of the new things. I would think in this day and age, much of what you do is for people who want to look younger.
That's correct.
So that would be probably eliminating wrinkles. And I saw recently on the national news a new procedure is a mid-facelift, I guess less invasive perhaps, or less recovery time. Explain it and tell us if you agree with this technique.
The mid-facelift is a procedure that involves the mid portion of the face. We look at the face in the upper third, the middle third, and the lower third of the face. And it is a procedure that is warranted in some patients. I think what you were referring to was something on the national news where they were making smaller incisions and they were elevating the midface. I think it's an excellent technique for some patients.
Is it being done here, or do you have to go to the coast to get it?
No, it is being done here, and it's been done for a long time.
Well, you know, there is that perception that you can only get decent plastic surgery in a place like Los Angeles, and I'm sure you would dispute that.
Yeah, I would absolutely dispute that, yes.
But what do we need to look for? I mean, it seems like plastic surgeons do so much now. They do the nose, the eyes, the facelifts. Should you get someone who does all of that or specializes in the procedure that you want?
I think that just like any other field, I think that you really want to find a specialist. If you're talking about the face, you're looking for a facial plastic surgeon. If you're looking for breast augmentation or some other body procedure, you're looking for a general plastic surgeon who operates in that part of the body. And
kind of quickly, if you want something to look younger, to get rid of the wrinkles, should you go with something like laser or a dermabrasion, or should you do the more involved, you know, cutting and all of that?
Yeah, when we talk about wrinkles, we're talking about photoaging. Most of the wrinkles are the result of the sun damage over time. In categories, skin resurfacing is a category of procedures that involves dermabrasion or laser skin resurfacing or chemical peeling. So depending upon what you're trying to treat, one of those three techniques would be most appropriate. Surgery, cutting, typically deals with sagging cheeks, with the jowls, the jawline, or the neck.
Okay, so it's totally for different things.
Two distinct, yes.
Okay, and most doctors do all of the above?
Well, I wouldn't say most doctors. Depending upon if you're a dermatologist or a facial plastic surgeon, you may do one or the other more.
Okay, so they're different specialties.
Absolutely.
Okay, well, thanks for joining us.
Okay, well, thank you for having me.
Now, if you'd like more information or want to ask more questions to Dr. Mendelsohn, his office can be reached at area code 513-351-3223 or online at cosmeticface.com. And he's in Hyde Park. Thanks again.